All right, let's start. So we're going to look at the manual handling procedure that has been developed around lifting techniques. Okay. So, in the last 12 months, there's been an increase in manual handling injuries at ABC. Most of these are from incorrect lifting techniques. We will learn the correct lifting techniques, and we will look at eliminating or minimising the manual handling hazards, and we'll also display clear instructions around the work areas. So as part of the Code of Practice, which is a practical guide to achieve the standards of health and safety required under the Work Health and Safety Act, Safe Work Australia has documented information and guides that we can look at. So before looking at correct lifting techniques, let's look at what are hazardous manual tasks. Do any of you know what a hazardous manual task is?
One where you can hurt your back.
Yes. So your back is very important, isn't it?
So lifting things.
Yes.
Bending over.
Bending over. Yep. Okay, so a hazardous manual task is defined as a task that requires a person to lift, lower, push, pull, carry, or otherwise move, hold, or restrain a person, animal, or a thing. Okay. So repetitive or sustained force, a high or sudden force, repetitive movement, and sustained or awkward posture. So these factors directly stress the body and can lead to injury. So who has health and safety duties in relation to hazardous manual tasks?
Everyone.
Everyone? That's correct. So looking at the workers that work on the processing line, lifting the boxes and putting them on packaging crates, you have a duty to take reasonable care for your own health and safety, and that you do not adversely affect the health and safety of other persons. Workers must comply with any reasonable instruction and cooperate with any reasonable policy or procedure relating to health and safety at the workplace. Yes? Okay. All right. So after numerous consultation that I've had as the work health and safety rep with the staff, I've been advised that there is no procedure or training being conducted with any of these hazardous manual tasks or any lifting techniques. So we will now look at how to perform these tasks correctly and to minimise the hazardous manual tasks or eliminate at least some of them. Okay. So I want to show a little short film clip, and this is going to be around 8 steps to correct lifting. Just bear with me. I'm sorry, I can't get the big screen working with this video.
That's fine.
Are you right to share?
That'll be fine.
By following simple, safer manual handling techniques, you should be able to lift most loads within the workplace. You should ensure you are fit enough to complete activities where the loads are heavy. If you feel uncomfortable while lifting or handling a load, you should stop immediately. You should use a mechanical aid, seek assistance, or speak to your employer.
Back movement within our comfortable range of movement shouldn't be a problem for us. However, when we're handling loads, and particularly heavy loads, we should try and maintain our back in a good posture. Forward bending and twisting when handling loads are most likely to cause a problem. Backward bending when handling loads above shoulder height can also be a problem. The muscles that are best designed to lift or push and pull loads are the muscles on the front of your thigh, your quadriceps muscles. These are a very strong muscle group, ideally suited for manual handling activities.
There are 8 principles of safer manual handling. 1. Think before you lift. initial assessment using tile to ensure you are capable of handling the load safely. 2. Adopt a stable base. Position your feet apart. Adopt an astride stance for lifting and a walk stance for pushing and pulling movements. 3. Get a good grip. Ensure you have a firm grip with the palm of your hand. Use handles where available and keep your elbows tucked in. 4. Keep the load close to your waist. This will ensure you are stable because the load is close to your center of gravity. 5. Bend your knees. This allows you to use your leg muscles to power the lift. 6. Adopt good back posture. Maintain the normal curves in your back and face forwards. 7. Move your feet. Do not bend and twist your back when lifting loads. Move your feet to turn with the load. 8. Move smoothly with your head up. Smooth movements will allow the soft tissues to adapt to movements, and holding your head in the upright position will put your spine in a good posture. We are now going to look at a technique for lifting and carrying loads, and for pushing and pulling loads. Lifting a load can strain your back and knees if carried out incorrectly. Safer lifting techniques involve keeping the load close to your body and near your center of gravity. Let's have a look at a technique for lifting a load. Assess the load. Set your feet apart for balance. Get close to the load. Get a firm grip. Bend your knees. Keep your back upright. Lift with your legs. Following these steps when lifting a load will help you move loads more safely and comfortably.
That was very good.
Mm. Very
So,
helpful.
those 8 principles will help at least identify any other risks that we might not have discussed here. The procedure will include further information in regards to posture and correct posture and pushing and pulling, as that will be part of it as well, as part of your practice. Is there any questions, or are you happy to wait until there's further information to come with the procedure?
I'm looking forward to that.
Yes?
Yeah,
Okay.
no questions.
Thank you for your
Thank you.
time.
That's fantastic.
Thank you very much. Okay.